Thank goodness for people like Dr. George Van Buren, Associate Professor, Surgery in the Division of Surgical Oncology at Michael E. DeBakey Department of Surgery at Baylor. That's one level where hope resides. And Rhonda here as well. Rhonda Williams is the founder director of the National Pancreatic Cancer Foundation, beneficiary of next weekend's Pancreatic Cancer Walk. Good morning to both of you. I want to remind you that the walk is next week. That's what we're here for, to talk about that a little bit. And we're going to have a Newsmakers Extra as well to talk even more about this disease. But Dr. Van Buren, we talked about hope. In your line of work where you are always looking for that, is there a reason now, based upon the research and some of the treatments that you have now, to have hope?
Yes, absolutely. The 5-year survival for pancreatic cancer has doubled over the past 10 to 15 years, but there's still significant room for improvement.
At this point now, when you have a foundation like yours, why did you establish this foundation? Was it for people to have hope and or information and or support, or a combination of all of that?
A combination of all of them. I think it's important that everybody have hope regardless of what their diagnosis is. It's a difficult cancer, but we always want everyone to have hope that they can get through it.
And you started this as a result of someone close in your family having been diagnosed.
Yes, I lost a family member in 2010, but started the organization in 2009. Originally, we did direct financial assistance for pancreatic cancer patients in order to help them, get through the cost of the medical care, and we just wanted to keep a roof over their head and food on their table while they were going through treatment, to just take that financial burden off. We've now moved into research. Probably the last 10 years, we've pushed more money into research.
And so now the walk next week is designed to go ahead and raise the money and awareness, I'm sure, right?
Absolutely, yes.
So I'm going to put that on my Newsmakers page, by the way, the information about the walk, so you can go and find out how you can get involved. November 19th is the date. November 19th is the date. Make sure you get ready to go. Get somebody else involved as well. Dr. Van Buren, talk about the challenges that you face now as a doctor in the research that you're doing now. Talk about some of the things that are hopeful for you making progress. You've talked about a little bit of it.
Absolutely. Some of the biggest challenges in pancreatic cancer is getting an early diagnosis of it. Because our pancreas is nestled deep inside of us and it has some vague symptoms for presentation, patients oftentimes don't know that they have the early signs of pancreatic cancer. And so spreading awareness about some of the signs that may be related to this, the abdominal pain, new onset diabetes, all of these are things that if we look into it a little bit deeper, these can be signs that somebody has something that is brewing or causing them problems, and we can diagnose it earlier and it can be more treatable long term.
So I want to talk more about that. There's a lot more to talk about this because of just the way this disease is. You strike me as someone who continues to have hope for all of this. True?
Oh yeah, every day. I talk to pancreatic cancer patients every single day, and we are always striving to give them hope and avenues in which they can do different treatments, clinical trials, anything that would help them survive.
Positive outlook on everything. And we're going to talk more about that on the Newsmakers Extra, so please go to that on the Newsmakers page. Dr. Van Buren, Rhonda, thank you for being here.